Good morning, my name is Javier Woman. I will talk about a supra biomarker for chronic kidney disease. Definition: chronic kidney disease slowly get worse and symptoms may not apply until the kidneys severely damaged. In the last stage that approaching renal failure, you may notice the symptoms caused by waste and the accumulation of additional fluid in your body. Application in nursing. Some conditions that may put you at greater risk for kidney disease include diabetes, hypertension, heart disease, had a family member with kidney disease, be over 60 years old. Pros and cons. Early detection can prevent the progression of kidney disease. These disorders are the most common type of kidney disease, so glomerulonephritis, a disease that causes inflammation and damage to renal fibrillation unit.
It's a hot day, and you've just downed several glasses of water, one after the other. Behind the sudden urge that follows are two bean-shaped organs that work as fine-tuned internal sensors. They balance the amount of fluid in your body, detect waste in your blood, and know when to release the vitamins, minerals, and hormones you need to stay alive. Say hello to your kidneys. The main role of these organs is to dispose of waste products and to turn them into urine. The body's 8 liters of blood pass through the kidneys between 20 and 25 times each day, meaning that together, these organs filter about 180 liters every 24 hours. The ingredients in your blood are constantly changing as you ingest food and drink, which explains why the kidneys need to be on permanent duty. Blood enters each kidney through arteries that branch and branch until they form tiny vessels that entwine with special internal modules called nephrons. In each kidney, 1 million of these nephrons form a powerful array of filters and sensors that carefully sift through the blood. This is where we see just how refined and accurate this internal sensing system is. To filter the blood, each nephron uses two powerful pieces of equipment, a blob-like structure called a glomerulus, and a long stringy straw-like tubule. The glomerulus works like a sieve, allowing only certain ingredients, such as vitamins and minerals, to pass into the tubule. Then, this vessel's job is to detect whether any of those ingredients are needed in the body. If so, they're reabsorbed in amounts that the body needs so they can circulate in the blood again. But the blood doesn't only carry useful ingredients. It contains waste products too, and the nephrons have to figure out what to do with them. The tubules sense compounds the body doesn't need, like urea, left over from the breakdown of proteins, and redirects them as urine, out of the kidneys and through two long sewers called ureters. These tubes empty their contents into the bladder to be discharged, ridding your body of that waste once and for all. There's water in that urine too. If the kidney detects too much of it in your blood, for instance, when you've chugged several glasses at once, it sends the extra liquid to the bladder to be removed. On the other hand, low water levels in the blood prompt the kidney to release some back into the bloodstream, meaning that less water makes it into the urine. This is why urine appears yellower when you're less hydrated. By controlling water, your kidneys stabilize the body's fluid levels. But this fine balancing act isn't the kidney's only skill. These organs have the power to activate vitamin D to secrete a hormone called renin that raises blood pressure, and another hormone called erythropoietin, which increases red blood cell production. Without the kidneys, our bodily fluids would spiral out of control. Every time we ate, our blood would receive another load of unsifted ingredients. Soon, the buildup of waste would overload our systems and we'd expire. So each kidney not only keeps things running smoothly, it also keeps us alive. Lucky, then, that we have two of these magical beans.
Yusha appeared in Ecuador. Dr. Mosquera, head of the nephrology department of the Luis Bernaza Hospital, revealed that the risk of developing chronic kidney disease is greater in the female population. According to some studies, has a very prevalence of 14% in women and 12% in men. Conclusion: biomarker panels will likely be useful for assessing the duration and severity of kidney disease, and for prediction, progression, and adverse clinical outcomes. For chronic kidney disease, this includes a similar plasma panel and urine panel. It will be important in future studies to validate the sensitivity and specificity of this biomarker panel in clinical samples of large cohort and in multiple clinical situations.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. Chronic kidney disease is a broad term that includes subtle decreases in kidney function that develop over a minimum of 3 months. In contrast, acute kidney injury refers to any decrease in kidney function that happens in less than 3 months. Now, the kidney's job is to regulate what's in the blood, so they might remove waste or make sure electrolyte levels are steady or regulate the overall amount of water. And they even make hormones. The bottom line is that the kidneys do a ton of stuff. Blood gets into the kidney through the renal artery, And once inside, it goes to tiny clumps of arterioles called glomeruli, where it's initially filtered. And the filtrate, which is the stuff that gets filtered out, moves into the renal tubule. The rate at which this filtration process takes place is known as the glomerular filtration rate, or GFR. In a normal, healthy person, this is somewhere around 100 to 120 milliliters of fluid filtered per minute per 1.73 meters squared of body surface area. This value is slightly less in women than men, and it decreases slowly in all of us as we grow older. One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidney start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephron's glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1, or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts. And then those mesangioblasts secrete extracellular structural matrix. This excessive extracellular matrix leads to glomerulosclerosis, which is hardening and scarring, which diminishes the nephron's ability to filter the blood. And over time, this leads to chronic kidney disease. The most common cause of chronic kidney disease is diabetes. In this situation, excess glucose in the blood starts sticking to proteins, a process called non-enzymatic glycation because no enzymes are involved. This process of glycation particularly affects the efferent arteriole and causes it to get stiff and more narrow, a process called hyaline arteriosclerosis. This creates an obstruction that makes it difficult for blood to leave the glomerulus, and increases pressure within the glomerulus, which leads to hyperfiltration, essentially pushing more fluid through. In response to this high-pressure state, the supportive mesangial cells secrete more and more structural matrix, which expands the size of the glomerulus. Over many years, this process of glomerulosclerosis once again diminishes the nephron's ability to filter the blood and can lead to chronic kidney disease. Although diabetes and hypertension are responsible for the vast majority of chronic kidney disease cases, there are other causes as well, including systemic diseases like lupus and rheumatoid arthritis, which can also cause glomerulosclerosis. Other causes, though, include infections like HIV, as well as long-term use of medications like NSAIDs, and toxins like the ones in tobacco. Now, normally, urea in the blood gets excreted in the urine, but when there's a decreased glomerular filtration rate, less urea gets filtered out, and therefore it has nowhere else to go besides the blood, and so it builds up in the blood, which is a condition called azotemia. Azotemia can cause general symptoms like nausea and loss of appetite. But as urea levels really build up, they can affect the functioning of the central nervous system, causing encephalopathy. This results in asterixis, a tremor of the hand that kind of resembles a bird flapping its wings, and is best seen when a person attempts to extend their wrists. Further accumulation can even progress to coma and death. This buildup can also cause pericarditis, which is inflammation of the lining of the heart. In addition, there can also be increased tendency for bleeding, since excess urea in the blood makes platelets less likely to stick to each other, and so there's less clot formation. Finally, in some cases, someone can develop uremic frost, where urea crystals can deposit in the skin and they look like powdery snowflakes. In addition to getting rid of waste, the kidneys played an important role in electrolyte balance. Potassium levels are particularly important, and normally the kidney helps with potassium excretion. In chronic kidney disease, though, just like with urea, less potassium is excreted, and so more builds up in the blood. And this leads to hyperkalemia, which can be problematic because it can cause cardiac arrhythmias. Another key role of the kidneys relates to balancing calcium levels. Normally, the kidney helps to activate vitamin D, which then helps to increase absorption of calcium from the diet. With chronic kidney disease, though, there's less activated vitamin D, so less calcium is absorbed into the blood, which results in hypocalcemia, low calcium levels. As calcium levels in the blood fall, parathyroid hormone is released, which causes the bones to lose calcium. Over time, this resorption of calcium from the bones leaves them weak and brittle, a condition known as renal osteodystrophy. The kidneys also release key hormones. For example, normally when the kidneys start sensing a lower than normal amount of fluid getting filtered, they respond by releasing the hormone renin to increase the blood pressure. In chronic kidney disease, the falling glomerular filtration rate leads to more and more renin secretion, which leads to hypertension. Now, remember that hypertension is a cause of chronic kidney disease itself, so this creates quite the vicious cycle. Finally, the kidney also secretes the hormone erythropoietin, which stimulates the production of red blood cells from the bone marrow. In chronic kidney disease, erythropoietin levels fall, and this leads to lowered production of red blood cells, and ultimately anemia. The diagnosis of chronic kidney disease comes down to looking at changes in the glomerular filtration rate over time. Chronic kidney disease might be suspected with a GFR of less than 90 milliliters per minute per 1.73 meters squared. Irreversible kidney damage might happen with a GFR below 60 milliliters per minute per 1.73 meters squared. To confirm the diagnosis, a kidney biopsy can be done to look for changes like glomerulosclerosis. Treatment for chronic kidney disease often involves managing the underlying cause. In severe situations, dialysis or a kidney transplant might be needed. Alright, as a quick recap. Chronic kidney disease is when the glomerular filtration rate falls below 90 milliliters per minute per 1.73 meters squared, over at least 3 months. Chronic kidney disease is mainly caused by diabetes and hypertension, and complications include electrolyte abnormalities, toxin buildup, hypertension, and weak bones. Thanks for watching. If you're interested